Hi. I'm Alex. I'm your therapist today. What's your name?
Hi, Alex. My name is Lindsay.
I got you. What brought you in today?
I'm just having a little bit of lower back pain and
I
stiffness.
got you. Do you care if you kind of like point to it or show me where it is?
Right. I would just say it's probably around this area here.
Okay. Sounds good. How long has that been going on?
I would say it's progressively been getting worse over the past couple of months.
Okay. Is there anything that makes it better or worse?
Well, recently I was just kind of picking up walnuts around the yard, and that definitely didn't help any. But at night I can take a warm bath, and that brings a little bit of ease.
Okay. Got you. What's your job?
I currently work a desk job, and I drive about an hour and a half one way to work.
Okay. I got you. Do you care if I look at kind of how you can bend forward and kind of do a couple different motions to see how you feel with that?
Sure.
Okay, so go ahead and try bending forward and just tell me, brings you pain, or I just want to see kind of like how far you can go without
Okay.
pain.
I would say about right here is where it starts to feel uncomfortable.
Okay, and again, it's in your lower back.
Yeah.
Okay. And then can you turn to your right and left without moving your hips, but just kind of moving your upper body?
Okay.
And is that about as far as you can go?
I think so, without it causing pain.
Okay. That's good. And then what about going, leaning backward?
I'd say about right there.
Okay. Okay. So it looks like you have, some tightness and stiffness in your back as well as pain, correct?
Right.
Okay. So what I'm thinking is that we might use a hot pack on you as well as do some stretching and strengthening exercises with you. And I want to go through some things that you need to know about it to begin with. There's some questions I need to ask. So you don't have any recent clotting or bleeding or bruising down in your back or elsewhere?
No.
Okay. And you don't have cancer?
No.
Okay. And as far as you know, you don't have any problems feeling whenever, say, people touch you or on your back or elsewhere?
No, not that I know of.
Okay. Do you care if I check before?
Not at all.
Okay. So all I need to do is, I'm going to lift your shirt up, okay?
Okay.
All I need you to do is say yes when you hear me touch you.
Yes. 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 Yes.
Okay, that's good. So then also, you're not pregnant or trying to get pregnant.
No.
You don't have multiple sclerosis.
No.
No. You don't have any heart problems or, say, where you might get swelling down your leg or your feet.
No.
Okay. And as far as you know, you're not do you use any icy hot on your back?
I don't.
Okay, or at least not today for sure.
Not today.
Okay. And you don't have any metal in your back, do you?
No.
Okay, sounds good. So what the hot pack is it's going to heat up the tissue in your back, and it's going to bring more blood to it, which will help you be able to kind of stretch a little bit more and not be as stiff. It'll help you to be able to kind of go through therapy, some stretching and strengthening exercises without sending as much pain. And it should feel kind of like you taking a bath, to where you might feel a little bit stiff when we get into the bath, say, but then after the fact you might be a little bit more relaxed. Your back might feel a little looser, and the pain is less, would you say, right?
Yeah.
Okay. And so I know we took your blood pressure, and it was, 130/70, is that right?
Yes.
Okay. So that's good. What the hot pack does is it will make you feel more relaxed, and with that, it does lower your blood pressure too. So it's just something to be aware of. And again, it's going to bring more blood into your tissue of the back with the heat, and it's going to decrease the pain that's being sent to your brain. It's going to quiet it down a little bit, and also just allow you to be a little bit more flexible with the back that's really tight and stiff. leave the hot pack on for about 20 minutes, but after 5 minutes, I'll come back and check on you. And that's typically, say if you were to do it at home, that would be the same thing. You don't want to go over 20 minutes. And in terms of frequency, I think it'd be good if we were able to maybe get on like a schedule where each night you spent 20 minutes using a hot pack on your back and went through your home exercise plan of stretching and the exercises that are on the plan. But say like on the nights or the days you have therapy, don't worry about it the night after therapy, unless say you have extra pain that day, then go ahead and do your home exercise plan. Ideally, I would like us to continue this sort of treatment for 3 weeks or so and see how you're doing. Hopefully the pain will be decreasing and your range that you can bend forward and do more functional things without any pain. And as long as our pain is decreasing and we're getting better, I would like to continue it for maybe about 3 months. And ideally, you earlier said your pain was about like a 7 out of 10, is that right?
Yeah.
Okay. So I would like us to continue to use the hot pack and this sort of plan until your pain gets down to about 0 during the normal day. And say if you have, say if you went on a run and it hurt, that's not horrible, but we would like to get the pain down to 0 before we stop using the hot pack.
Okay.
So what you should know is because the hot pack is hot, it is capable of burning you or even kind of damaging your back, the skin on it. So what we'll do is use extra towel layers. We normally do about 6 to 8. And if you do it at home, it's just something to be aware of. That's why we only do it for 20 minutes, and that's why we make sure our hot packs are kept at a certain temperature. If you do it at home, start with one certain temperature and see how it feels. And you can always take off some towel layers to make it warmer, or you can also heat up the hot pack a little bit more depending on that. And we can get kind of that set up with you before you leave today. Are you okay if we put the hot pack on you today?
Yeah.
Okay. And so I'm going to go ahead. Will you lay down on your belly on the table?
Okay.
And I'll get the hot pack.
There's a spider right by my face.
There's a hot pack in here, and then again we have 6 towel layers. So we're just going to put it on you, and we're going to leave that there for about 20 minutes total. But here's a bell, and if you need anything, if you feel any pain, or if you feel able to feel the burning, feel free to ring that bell and I'll come over. But I'll come back and check in about 5 minutes. Okay, so how are you doing?
I think we're doing great.
Good. So I'm just going to check your skin to make sure you're okay, okay?
Okay.
Okay. So yeah, that looks good. Okay, so I'm going to put it back on and leave you for another 15, and we'll start doing our stretches and exercises.
Okay.
Okay. Scene.